Hi, I'm Jordan Heath. I am one of the newest allergists and immunologists with SciMed Health. I knew pretty early in life. My dad was a physician, so I have a lot of memories in childhood of going to the hospital with him and being exposed to healthcare at a pretty early age. So it's kind of something I always had in my mind. So allergies happen when a specific type of antibody that we all have in our bodies sees something in the environment or a food that you eat or a medication, and it mounts an immune response to those things, which creates kind of a cascade of different markers and mediators that cause inflammation and allergic symptoms. A lot of the same types of disorders can be present in adults and kids, but there are some unique to each. So you can have different diseases and allergic problems in adults than you can kids. And a lot of times the treatments can be different as well. You treat things a little bit differently in kids sometimes than you do adults. So the same things are sometimes there, but there's a few differences in each age group and different ways to manage them. I am a parent myself, and my kid has some allergic issues as well. So I sympathize with the plight of parents who have allergic children. One of the things that I would recommend generally, especially with food allergy, is trying to be vigilant about labels. When your kid is young, you are pretty much the sole responsibility for making sure that they avoid those foods and things that they don't need to have exposure to. But as they grow up, it's also important to make sure that they learn not to eat these things and why it's important, and to take a little bit of responsibility for their health once they get to be in later childhood and teenage years. And also just to know that just because you have tried a medicine or two, maybe given over the counter that you've bought, there are plenty of options for treatments in allergies, especially when it comes to environmental allergies, that we can help with and try and guide even environmental changes to where maybe you won't have to take as much medication. I like to think I'm pretty friendly in general, but also pretty open and honest. If I either don't know what's going on, I don't think it's an allergic issue, or if I feel like there's nothing I can do to help you, I'm going to be honest about that when people come to see me, and try and just be straightforward, because that's how I want people to be with me. I'm excited to be here in Gainesville, and my family and I are looking to put down some roots, so we're planning to stay here for the long haul, and we're very appreciative to SciMed Health for giving us the opportunity to start that practice. And for me specifically, I'm very thankful for a practice that's allowing me to see and use my training for both adults and children. Since I feel comfortable with both, it's nice to have an opportunity to get a wide variety of ages.